introductions. So thank you all if you're watching. My name is Amanda Montgomery, use she, her pronouns. I am the manager of wellness here at Heartland Health Centers. And I'm very excited to be here with Dr. Anuj Shah and with Dr. Chacko to talk a little bit more about monkeypox and ask some frequently asked questions. So just a little bit of information before we get started. If you're watching and you have questions, feel free to write them in the chat as we go along, and we'll definitely make space at the end if you have questions to answer those or direct you to some resources, and any resources that are mentioned in the Facebook Live, we will be sure to put those links in the chat as well. And before we start, I'm going to pass it off to my colleagues to introduce themselves too. So Anuj, you're first on my screen if you want to introduce yourself.
Thank you, Amanda, and again, thank you for joining us. My name is Anuj Shah. I'm a family physician and integrated medicine physician here at Heartland Health Centers. I work in the Lakeview site. Happy to join you.
And I'm Chacko, family physician over at the Albany Park site, pronouns he, him. Yeah, I do HIV care as well for our clinic, for our patients at our clinic. So once again, good evening, glad to be here.
Great, thank you so much. Thanks both of you for being here. So maybe we can just get right into it and start by understanding what is monkeypox.
Yeah, I can probably start if that's okay. So what is monkeypox? So monkeypox is a term that we that has been in the lay community for a virus called MPV, and it is a pox virus. That's the family of viruses. It's a virus that's transmitted initially from animal to human, and it causes a syndrome of high fever, of headache, of kind of flu-like symptoms, followed by really painful lesions. And it's a virus that's been actually around for at least 50 years, if not 70 years. And with most of the cases being in West Africa and Central Africa for the last several decades. But now it's become more of an attention as it's become more prevalent in around the world and in Western countries.
And I would just piggyback from Anuj here. You know, I think we've had our fair share of viruses. You know, it used to be that you'd have to explain what a virus is. Unfortunately, I think we've all heard about viruses, and viruses have a whole spectrum of how easy it is to get and how, you know, how much what they do, right? And so on that spectrum, you know, monkeypox or MPV is not something that gets passed on very easily, and we'll probably talk about that in a little bit. There are some very kind of particular circumstances that put you at risk for getting it from somebody else. And I think the big classic thing is exactly what Anuj said, these painful bumps that can really, if they're in sensitive areas, can cause a lot of complications and pain. So yeah, we'll talk more about that, but I think that's the main takeaway. It's a virus. It can get passed from one person to another, but it's not very easy to pass just in regular contact or like regular day-to-day contact. And it causes painful bumps and can have some complications, and that's why it's important for us to be aware of that.
Thanks. That's super helpful background. I wonder too, actually, Ron, you just mentioned this, but how does somebody get monkeypox?
Yeah, I can take this on, and then feel free, Anuj, to jump as well. You know, I think unlike other viruses where we think about a cold, right, where you sit around and someone sneezes and you're like, oh my goodness, it's everyone gets it, or COVID, which everyone was wearing masks for a period of time. This is not as infectious, and the main place where you get, where you can get where this virus passes from one person to another is with extremely close contact. So like if you're, skin to skin contact, So this usually happens with like intimate partners, like family members who might have it, passing it on to one another, or other places where you might have skin-to-skin contact, like intimate partnerships. So that's the main way. This is not something that you're going to get, sitting on the bus and, someone walks by with monkeypox, right? I think this is just something for us all to take a deep breath. We've had a lot of like virus fatigue. But at the same time, if you're the folks that are near to you and dear to you, the folks that live in your household, the folks that you are intimate with, if they are folks at risk for monkeypox, then this is something that we need to take seriously.
Yeah, the other thing I'll say about that is, with that skin to skin contact, it's skin to skin contact with someone who has lesions,
Right.
someone who is infected. So it's not that if you are skin to skin contact with someone who is not having any symptoms, you are now at risk of getting monkeypox. Again, just like Ron was saying, with COVID, someone may not have symptoms of COVID, but they still may have the virus. They still may be contagious, and you may be in the same room with them and for a prolonged period of time, and you're at risk of getting COVID. Monkeypox is not the same way. The person will have lesions, they will be in pain, and you will have prolonged contact with that person, prolonged skin-to-skin contact with that person who is already sick.
Yeah, that's really good to know, and important to see the differences between a lot of the viruses that we come in contact with in our population. If somebody does get monkeypox, what is the infection length like? How long are you infectious for? Do you need to quarantine, like in a similar way that you would quarantine for COVID, or what does that side of things look like if you have monkeypox?
Yeah, that's the tough part about monkeypox is the length. So one thing to be said with monkeypox, it is not, as of yet, it's not a very, people aren't dying from monkeypox. So it is a very painful, but is what's called self-limited, meaning after several weeks it will be going away. So usually the time course is after exposure. Symptoms may start anywhere from like 5 days to even up to 2 to 3 weeks. I think mostly it's around 1 to 2 weeks, but it can go all the way up into 3 weeks. Is when symptoms would start. The symptoms would start, like I had said before, as like a flu. So you would feel feverish, headache, what's called lymphadenopathy, and what that means is swollen lymph glands. You'll feel like stink. You don't feel good, and then that's followed by the painful bumps, and those painful bumps can be in various places. When you have those painful bumps, that's when you're contagious. So long as you've got those bumps present, that you are contagious. So it is recommended that a person is in isolation while they have painful bumps. And that can last up to a month. I think it's about 3 weeks, 2 to 3 weeks, but it can be up to a month. And that's a long time to be in isolation from others. Yeah.
And I would say, most of the time there is that, like every virus, right? I was just smiling because I think it's like natural for us to see viruses, flu-like symptoms, but it really is. It's kind of that like not feeling good is probably the best way to describe it. And then with those bumps, it's because those bumps are where the virus really sits on. So so that's the risk, and that's why we recommend isolation until those bumps completely heal. They go away and there's a new layer of skin there, because as long as there's some part of that bump there, that virus could be on top of it, and rubbing up against someone near and dear to you or someone you're a partner with can put them at risk of getting that virus from that bump.
Yeah, that's really helpful. So just to clarify, right, it's the virus is really in those bumps, and not so much, if you're coughing or sneezing or those other aspects of how you're going about your daily life.
Yeah, typically, like monkeypox is kind of more for the rash than it is like you'll feel awful. You might have some early symptoms, but it's more the rash that's the part that's most concerning, and the liquid that's on those bumps. I will say, right, like, we're talking about the general population. So naturally, if you're someone who has HIV and hasn't been seeing a doctor, and maybe your immune system's not very strong, or maybe you're taking medications for other reasons that weaken your immune system, you do have a higher risk of getting more serious complications. And they are rare, but they, very rarely, monkeypox can cause some increased bleeding or cause lung infections or cause infections to the brain. These are not very common things, but they tend to happen more often with folks who have either significant reasons why their immune system is low, or they have significant other skin conditions for which the virus can easily pass more effectively through the body. So we'll talk a little bit about vaccines, but this is, if you're in that group, this is definitely you might definitely, if you haven't considered getting vaccinated for prevention, this would be something to consider.
And back to the transmission piece too. Right now, I think we're seeing mostly transmission being in that prolonged skin-to-skin contact. I think there is maybe some data about it potentially being present in breath or in air, potentially being what's called fomite, meaning like on a surface, like, where someone sits. But we haven't really seen that transmission in this wave. And so although there is that potential, out of the thousands of cases that are out there, that's not something we're really worried about, like, oh, someone touched this or someone breathed on me or coughed on me. That's not something we're worried about at this time.
And just to reassure folks, as we're talking about fomites and surfaces, right? Like, especially surfaces, if you have to go to the clinic for whatever reason. I know you're thinking, like, here's two docs talking about monkeypox. I don't know if I want to go to the clinic, because what if there's a patient with monkeypox? There's definitely, typical cleaning, which happens in most public places, especially in lieu of COVID. Detergents and are sufficient. Clorox, the typical things that we use to sanitize will get rid of the virus. So this is not something that's super robust. This is something that, with regular cleaning is not a risk at all in that way. So, I think Dr. Shah was referring to, if it was there, that risk of getting it is potential, but rare. Just to reassure folks, most public places, especially the clinics, and I can say for sure Heartland, we keep everything nice and clean so that that's not a concern for you coming in.
Thanks. Yeah, that's really, really helpful, because I know there's sometimes a little bit of confusion on how something gets passed or how you might get a virus.
Yeah, and when this wave really first started, I was super concerned. I was scared, right? So even going to the gym, like, do I sit on the benches and on the machines? Using a public restroom, and I was really worried because here's what viruses do. But as the wave has progressed, and as we're seeing the data of where people are getting it, the thousands of people have gotten it, it's not from the gym, it's not from a public restroom, it's not happening that way. So I am much more relaxed now of like, okay, yes, standard precautions, of course, but I'm not as worried that, I'm not going to get it from the gym or from a public restroom or something like that.
So just for reassurance, right? You're going to the gym right now? Is that like after that fear? I'm going to the gym. Just want to make folks, aware, like, we are living our normal lives in terms of our day-to-day. This isn't stopping us, and it shouldn't stop y'all either.
Yeah, that's really, really helpful. Yeah, and I think sometimes we're not sure if anyone else feels the same way. So that's really great to hear from you both too. Ron, you mentioned this earlier, but you started talking about people that might be at a little bit higher increased risk for monkeypox. I was wondering if y'all could speak about who is at risk. Are we all at risk? Or are there folks that are more at risk for the monkeypox virus?
Yeah, I can take this. Essentially, it really is about close contact, right? So, and particularly close contact with someone else who has monkeypox. So, like, this is not the case of like, and close contact with someone who's got monkeypox and has those bumps, and your body touching those bumps as well, right? So this is really we're kind of taking this and stepping back in time here a little bit. there's, and I don't know offhand the number of cases. There's not, I mean, there is some, but it's not, if you look at a population of 6 million, this is not something that's just like everywhere right now in the general population. And so this is really about, if you have close contact with someone who has monkeypox, or someone who you're intimate with, who has monkeypox, that's where that risk is. It's in your networks. Typically, this affects, gay, bisexual men who have sex with men, transgender persons who are sexually active. That's probably like the most common individuals that have come positive. So I think that, if you're in that network or in that community of individuals, it's definitely worth considering, what can you do to prevent yourself? But I still wouldn't say like, we'll probably talk about some tips to reduce your risk, but this doesn't mean that you can't just still enjoy life. It's just being thoughtful about what enjoyment looks like in this season.
Yeah. Thinking about those cases, I just happen to have it pulled up too, that in Chicago, as of now, what is it, September 1st, there have been a reported 860 cases total in Chicago. And the great thing is that the case count week by week has been going down. So there was a peak back in end of July when there was 1 week where we had 141 cases, the next week 138 cases, just those weeks alone. In the week of August 20th, there were only 79 reported cases. So far this week, only 48 cases. So the number is going down. And you can find all of this information on chicago.gov, where they update it week by week or day by day. And you can see the people who are tending to get it, or right now, 92% have been cisgendered men, so majority cisgendered men, and 69% so far have been self-identified as gay or lesbian, with only 4% self-identifying as straight or heterosexual. So that doesn't mean that there's anything particular about being a gay man that makes one more likely to get monkeypox. There's nothing about my body that makes me more susceptible because I'm a gay man. However, like Ron said, it has to do with the networks, right? So I might be more, as a gay man, I might be more likely to have prolonged skin-to-skin contact with another gay man, right? And if that's where the networks where this virus tends to be right now, then this is the community that is being impacted, and that's different, right? In what we see in, for example, in Nigeria, right, where families are getting it, right? So it's little children who might be getting it, and then the mom is hugging the child for a long time, and then the mom gets it. So it just has to do with what community happens to be impacted. And right now in the Western Hemisphere, or particularly in the United States, it happens to be gay men are self-identified.
Thank you both, and thanks for clarifying that, Anuj, because I know that there was some confusion around that too, and wondering if this is something that maybe is just impacts gay men or the LGBTQ community. So it's helpful to hear that context too. Shifting over, right, and thinking about prevention, y'all have mentioned a lot of things already, but do you have any other tips for folks that are concerned about it and how to prevent monkeypox?
Yeah, so vaccination seems to be what we're hoping will be helpful. We have, to be honest, we have limited data with the current vaccine that we're using with this current wave, but we have good data from all of the previous studies that have been done, particularly with smallpox and with the other and how this vaccine works in animals and that bit. So vaccination. I really like some things I've been seeing from the Chicago Department of Public Health around communication, so vaccination communication, right? So if you are someone who is symptomatic, of course, communicating that to your loved ones or people who you're intimate with. If you're someone who's intimate with one or more people, communicating with them. How are you feeling? If you are intimate with people that you usually don't have long conversations with, right? So if you're someone who hooks up or uses an app to hook up with folks, maybe using this time a little bit more to let's communicate a little bit further before we do hook up around what, how are you feeling? Do you have any lesions? There was even a nice campaign that was saying, before you do anything with the lights off, start with the lights on. So take a look, just like, hey, are you doing okay? Everything looks okay. All right. So continue to live your life like Ron was saying, but be smart about it and communicate and keep those lines of communication open.
Yeah, I mean, I would agree with everything Anuj said, and then maybe a couple other points that come to mind that I might just add in is one, we talked about this idea of your networks. So maybe if you're kind of feeling more cautious, it's an opportunity just to think about maybe thinking about your networks of intimacy and kind of maybe if you have a core group of individuals that you feel more comfortable with, that may be something to consider. Especially if, I recognize that open and honest communication is always the right answer, but can always kind of be a little tough for some folks. Because as much as we'd like to say this, there's nothing to be sorry, to feel stigmatized about, that this is a virus that affects everybody, regardless of, there's no reason to put someone in a particular bucket because they have monkeypox. At the same time, I think we recognize realistically this can make it hard to talk openly. So one thing might be thinking about your kind of your networks. If you don't use condoms, maybe worth considering condoms, right? We talked about this idea of skin-to-skin contact being a big factor. So, while condoms aren't completely protective, it could reduce that risk, especially if you have sex using, your penis or your anus. And then the other thing I might consider is like wearing more clothing. So like if you're having sex and you want to kind of minimize risks and you don't feel comfortable with any of those other things, just even things that will kind of prevent you from having as much skin-to-skin contact, right, could potentially protect you. I mean, I think, to go without saying, as Anuj said, first and foremost, like vaccine, right? There is a vaccine out there that is safe for use. We talked about monkeypox as a virus. It's very similar in family to smallpox, right? Which most of us probably aren't familiar with, but 50, 70, 80 years ago, this was a big deal. And we have all but gotten rid of it in the world until, because of vaccinations. And there's, Anuj and I were just talking about how, one of the theories as to why monkeypox has become a bigger thing in this particular era is because smallpox, when smallpox was more prevalent, we all gave smallpox vaccine. Well, this smallpox vaccine has been shown to be beneficial to some extent with monkeypox. And so this is something that does have some experience, using this vaccine Jynneos, which we'll probably talk about in a bit. But getting that vaccine could be really protective as well. And just one more thing in that armamentarium.
Yeah, those are really, really helpful thoughts in thinking about preventing monkeypox. So thank you both. And we are going to talk about vaccines, but before we go there, I was just going to also thinking about, y'all talked about prevention in kind of a social context, but if somebody does think that they've been exposed or that they have monkeypox, are there other things that they should do, or how can they get treatment? What does treatment look like?
So I would say if you think you've been exposed, I think it's worth talking to your primary care clinician or talking to someone about whether you could get, access to the vaccine. There's been evidence that the vaccine is, for most out of all the groups where vaccine can be the most helpful, this is probably the group where the vaccine is the most helpful for someone who's been exposed before you have symptoms. So I think this is why, if you feel like you're at risk, talking to someone to see if you'd be eligible for the vaccine makes a lot of sense. In terms of treatment, this is a virus, and I know everyone hates going to a doctor for a virus and being told, like, let's help you with your symptoms, your body will fight the virus. But as in most cases, as Dr. Shah pointed out, this is something that's self-limiting. And while it can be painful at points or more irritating, your body will fight it off on its own. And there are, depending on where the lesions are, if they're on, there are, strategies that, you could use to kind of minimize the symptoms. That said, if you have lesions in your mouth or near your eyes or near your anus or near your genitals, or if it's really painful, there is medication that we can give to help reduce those, reduce symptoms and potentially help, resolving things a lot faster. And that's a medication called tecovirimat, which is, you got to love doctors and I'm not going to blame doctors, but that fancy, loud, complicated names. Most people call it TPOX, so that may be something you've heard about. And that is a medication we give to folks who are either at high risk for serious complications, like we talked about, immunocompromised, or having significant skin issues, or if you have severe pain, or if you have locations in extremely sensitive areas. This is a medication that we like to give as soon as we can. It's 3 pills twice a day for 2 weeks. But it's been shown to be somewhat helpful in reducing the severity of symptoms and moving towards cure. Once again, I say that with some caveats, but generally the evidence has been very, very good. Yeah, so we can talk more about that if folks are interested.
Yeah, and to reiterate, not everybody who has monkeypox needs TPOX, the medication. And as Ron said, most people actually don't. Most people, it is still a painful disease, for several weeks. But it's really for folks who are more high risk of having severe complications, or it's really affecting, the way that they're eating or stooling. Those are folks that really, plus, some others, like those are folks who really would benefit from the medication.
Thanks. Yeah, that's really helpful. I know there's a lot of lingo and different words that can come out sometimes around stuff like this, and I definitely was confused for a little while. So that's helpful terminology to understand and to know when to use TPOX. Going into vaccines, who should get a vaccine, or who is the vaccine recommended for, and when should you get a vaccine?
Yeah, so as Ron said, if you've been exposed, especially within the first 2 weeks, that's the most beneficial group of folks to get the vaccine. And the thought is that even though the virus might be in your system, if you get the vaccine, it helps build up your antibody to help suppress it a little bit. So if you've been exposed, you had prolonged skin-to-skin contact with someone who's been diagnosed with monkeypox and you saw those lesions, then you should get the vaccine. Right now in Chicago, I think it's all of Illinois, and Ron, tell me if I'm wrong, but it's also indicated for any men who have sex with men because of that network that we are seeing, at least in Chicago, of the transmission. So any sexually active men who have sex with men, I should say, or those who are exposed. I think those are the groups now. Ron, any other thoughts on that?
No, that's exactly it.
Things might change in the future, around, for example, certain healthcare workers who, especially those who handle like lab workers or those who handle a lot of monkeypox cases or MPV cases, but right now this is the group.
And that's right. Not to go tangential, but just to kind of make a point that Dr. Shah just kind of alluded to, right? We use these phrases interchangeably. So if you hear monkeypox, if you hear MPX, if you hear MPV, if you hear MPXV, it's all kind of the same thing. So just to kind of keep folks, sometimes just even getting the lingo sorted out can be helpful. So just wanted to put that out there.
Yeah, definitely. Thank you so much. There definitely is a lot of different acronyms. Yeah, and then this vaccine is 2 doses, is that correct? And when do you get a second dose? Like, how does that work?
Yeah, I can take this on. So like, initially the big push was like one dose. And part of that is because Jenios, is originally a smallpox vaccine, and it's something that we had in the national like storage for if there was a smallpox outbreak, right? There wasn't a lot of doses of this. And when the monkeypox outbreak started in the United States, it had to get spread across the nation and more had to be created. And so the big push initially was for like one dose for anybody who would be at the highest risk. So you might have heard, like, I think sometimes even with COVID, it can be kind of frustrating because you feel like you hear mixed messages. And part of it, sadly, is because these are new things for our country. And also kind of trying to get resources to where they're needed is sometimes a slower process than we would like. So, initially, so this is where that criteria for vaccines has changed over time. We now have more vaccine in the city. And so this is why we're kind of opening it up to everyone who could benefit from it the most. But also you're going to hear more and more about this idea of two doses. So, if you're someone who got one dose and you heard the doc say like, okay, it's okay to get one dose, that's all you need. And you were asking like, why? I thought I needed two doses. After that first dose, your body starts building immunity. And so you get protection within days after starting that first dose. But it really is after that second dose where you have the most protection. So, typically, it's 1 month or 28 days after the first dose is when the second dose is recommended. And like I said, we have it at Heartland Health Centers. I know other clinic sites will have it as well. Of course, I will mention Heartland Health Centers again. But yeah, literally within days of starting to get the vaccine, you will have some protection. It tends to peak after about 2 weeks, but it's that second dose that really increases your protection. So trying to get that second dose now after, like I said, 1 month after getting the first vaccine, presuming that you haven't been infected with monkeypox. So that's one of the other catches here. You might say like, do I need to get the vaccine if I'm recovering from monkeypox? And the answer is no. This is something that we will probably learn more about as we get more information from folks who have had monkeypox, like what happens to them over time. But right now, the recommendation is 2 doses if you have not had monkeypox.
And not to be a downer, but I want to kind of go back to the 1 dose versus 2 dose and the response protection versus. So, again, as I've seen, and correct me if I'm wrong, but as of there isn't still a lot of data on the protection of of this vaccine against the current outbreak. So, and I know that because I've seen it a lot on my social media. It was also brought up at a meeting that we were just at recently. This study that was out there about your antibody response after the first dose, the antibody response after the second dose, and how you have a buildup of antibodies after that first dose. That study, again, there was this graphic that was going along all in my social media and among my friends and folks saying, oh, well, I got 1 dose, so I'm safe. I'm at least somewhat safe. And I was pretty cautious about that. I'm not saying that people aren't protected. I'm just saying, as someone who's cautious, we know that we think there's likely an antibody response. That particular study, I actually looked at it, and it was a very small study. I think there were like 80 or 90 participants in that entire study or less. So it was a very small study, and that was looking at the antibody response, how much antibody is building up in a person. But it wasn't looking at protection against infection or protection against disease. That we don't know yet. So it is recommended, for that maximum antibody response, not recommended, but for that maximum antibody response is 2 weeks after the second dose. So, so that's, again, I think that more studies will come along and will say that, oh, protection does start much earlier. But I haven't seen anything that says yet, like the protection is there. The antibodies are there, but not necessarily, we don't know that people are protected.
I think this brings up like 2 main points, right? One, which is just, I think and I think we probably are a little bit more comfortable with ambiguity from these past 2 years. And I know on some level, we all want less ambiguity and more certainty. I think this kind of gets to that point. If you're someone who tends to move towards anxiety and fear, like don't worry and don't stress, right? Like there's no need to, anxiety isn't going to help you. And like, it can be detrimental, right? So like, I think this is a chance for you to take a deep breath. The vaccine can be protective and can be kind of reassuring. If you're someone who tends to play it loose and kind of carefree and fancy free, and you see the vaccine as a ticket to like get out of jail, so to speak, this may be a chance. I think Dr. Shah rightly points out, like, wait 1 second. Like, this may be a chance for you to just use a little bit of caution, because there is evidence of potential benefit. But these studies have been very small because these outbreaks have been small and the use cases have been small, and we'll learn more, unfortunately, as time goes on. So, but there is reassurance that there's some level of protection. To what extent, we don't know. So I think if you worry, take a deep breath. If you tend to be super, super chill, then maybe, just use a little bit of caution.
Yeah, that's really, really helpful to hear, and just to understand how to think about what this vaccine is going to do for folks that are at risk or that maybe have been exposed to monkeypox. So that's very, very helpful. And I think brings up an important point, because I know this came up a lot with the COVID vaccine at the very beginning, and we're kind of in the beginning few months of experiencing monkeypox here in the US. Is the vaccine that we use for monkeypox safe? And just thinking about smallpox versus monkeypox, and is it something safe that folks can get?
So, I mean, I'll preface this by saying, like, I'm a pro-COVID vaccine person personally. I know hopefully that doesn't turn people off on this camera, but I also imagine that, you're talking to someone who does family medicine and working in, but I would say that, even more so than that, smallpox has been around for many years. And so the smallpox vaccine is something that has been tested and trialed out for numerous years. Like, this is not a new technology. I mean, this is even older than than our kind of stable technology that we recommend for COVID. So there's been tons of studies looking at the efficacy. I mean, the safety. I shouldn't say efficacy. I apologize. There's been a fair amount of research done on the safety of the smallpox vaccine, or the Jynneos vaccine. So that is something that we feel pretty confident about. In terms of efficacy, that's the kind of the question mark. But safety has been proven through.
Yeah, and the big side effects are pretty much what I've seen is pain at the site of where you get the injection. The arm hurts for a bit. I'll tell you, I got my dose. It was painful for a bit, but that was it.
Yeah, I mean, I think the one unique thing about this particular vaccine, especially for adults, we tend to put it. I don't know if you guys have ever had like the tuberculosis test where they put it in the skin, like not inside not under the skin. So if you're someone who tends to get scars, like if you get like those big scars after you get a cut, that may be something to let your clinical team know before you get the vaccine, because that may be a reason to get it under the skin instead of in the skin. And there's some very rare, like if you have an allergy to ciprofloxacin, for example, which is a pretty, not a very common antibiotic side effect, but or allergy. But if you have that may be something to talk about with your doctor or clinical team. But otherwise, yeah, there's really not a lot of like watch out for us with this particular vaccine.
Yeah, that's really good to know. And I have one more question about vaccines. Where can people get the vaccine for monkeypox?
Well, Amanda, you could probably say better, but of course, here at Heartland Health Centers, if you are a patient of Heartland Health Centers, please contact us and we can get you in and get your vaccine for your first dose or your second dose. Again, that is for Heartland Health Center patients. If you're not a Heartland Health Center patient and you live in Chicago, there are several sites that have been run by the Chicago Department of Public Health. I would direct anyone to the CDPH website, or if you're on Instagram, follow their Instagram page. They have announcements almost daily about where they're having their vaccine clinics during the week, on the weekends. You can make appointments for them. Plenty of the primary care offices here in Chicago also are giving the monkeypox vaccine to their patients, such as Rush University, Howard Brown. Yeah, I would ask your primary care if they have it. If not, you can go to CDPH, or you can become a Heartland Health Center patient and And not only do you get your monkeypox vaccine, but you also get great primary care.
Thank you, Anuj. You said it beautifully. And we will put the information for how to call if you're interested in becoming a patient at Heartland, or you are a patient and you want to know how to get, the vaccine. We'll put the contact information in the chat, and then also the link to the Chicago Department of Public Health website and Instagram too. Those are great resources. I think just the last thing before we can kind of wrap up for today is there anything else that I didn't ask or that wasn't really mentioned in this conversation that y'all think is important to mention about monkeypox?
I have a question for Ron, actually. So if somebody is having symptoms, and they think that they might be eligible for medication, for TPOXX, the medication, can they go anywhere to their regular primary care doctor, or do they have to go somewhere special to get that medication?
That's a great question. Unfortunately, TPOXX is a little bit complicated in terms of getting access to it. Your best options, if you're a patient at Heartland, call us. We have access to TPOXX, and we can get you into somebody who can get you that medication. I believe, and we can try to find this link as well. CDPH also has like a set of resources that you can get where to call to get in contact with someone who is able to prescribe you TPOXX. So typically, if you're not sure, call your office. If your doctor's office isn't sure, call CDPH and they can connect you to resources, or contact us and we can say, if you want to join us, get care from us, and then we can kind of see where we go from there.
Yeah, and I guess that's a tag on that, because I know we have it at Heartland, but for patients who are not Heartland patients, I imagine, and Amanda, you can answer this too, they can probably call us to become a Heartland patient, and then we can get them coordinated.
Yeah, exactly. If you aren't a patient of Heartland, you do have to become a patient and have a primary care provider here at Heartland in order to have that visit and see if you qualify for TPOXX. But you can definitely call and make an appointment with our call center, and we'll put the phone number in the chat and our website link as well. But absolutely. Great. Anything else? Any last thoughts? Or things that we didn't discuss?
Yeah, I mean, I think I would just iterate what I said earlier, right? Like, this is not something to be scared of. This is something to be educated about, and just kind of arm yourself with knowledge. Use caution. I know we're all tired of caution, because caution has kind of been the buzzword for the past 2-3 years. But I think, I think if you're someone who might benefit from getting vaccinated, get the vaccine. Just kind of keep up to date. I mean, I do think that the Chicago.gov's got some good updates for monkeypox. The CDC's actually got some pretty easy to read information. And then as things develop, we'll have more to share, I'm sure. But I do think, it's reassuring to see that the numbers are going down. So this is not something that, unlike COVID, where we saw the numbers kind of skyrocket rather quickly, this is one where the numbers are stabilizing and in fact kind of dropping a little bit here in Chicago. That's not a reason to let down our guard. It's just a reason to kind of maybe catch our breath a little bit and just arm ourselves with knowledge.
Great. Thank you both so much. It's been super, super informative. And I appreciate you all taking the time to be here. And I appreciate for everyone listening too. Thanks so much for chiming in. This stays on Facebook, and we'll add it to our YouTube page as well. If you want to watch again, or if this is your first time seeing it and you want to rewatch, you're welcome to check it out those places. But thank you both, and thanks everyone. Have a great evening.
Great evening, guys.
Good night.